For those with an active lifestyle, nothing can slow you down more than pain, especially joint pain. Though pain can occur anywhere in the body, and it can be caused by any number of conditions, there is no need to live in pain or discontinue an active lifestyle.
People with active lives can have two types of pain, the acute pain and the chronic pain. The acute pain is the one that occurs all of a sudden. Usually it's very common, for example, like walking or practicing any sports, and it's localized mostly or in general in the shoulder and the knee. The other type of pain is the overuse type of pain, is the pain that occurs that takes a little bit of time to occur, and is mostly due to what I said, an overuse, just because of a repetitive type of motion.
Whether the answer to your pain is as simple as physical therapy or as complex as total joint replacement, there is a solution for every type of orthopedic ailment. In order to make an informed decision, it is important to know your options.
The patients have a lot of options to manage the pain. It goes from a very simple advice of giving a prescription for pain medication to just isolate, elevated, to a more complex treatment like physical therapy, and in extreme cases, surgery. Does it hurt when I do that?
No, sir.
Oh.
Dr. Raul Marquez is an orthopedic surgeon in Edinburgh, Texas, specializing in sports medicine and joint reconstruction. He says whether your pain is temporary or recurring, or your medical condition requires surgical or non-surgical treatment, a qualified physician can develop a plan of care that is right for you.
To assess the patient's problem, first we need to interview the patient, we need to talk to the patient so he can tell us or she can tell us what the problem is. Once we know what the problem is, then we take the appropriate diagnostic test, like in most of the cases an X-ray. But if it's a more complex case, we probably will need an MRI. Once we know the diagnosis, then we can plan a specific treatment for the patient.
At his practice, MarquezOrthopedics, Dr. Marquez and his team strive to make it as convenient as possible for the patient by offering in-house radiology testing, MRI services, and physical therapy. They also handle workers' compensation cases. His surgical patients don't need to travel very far for their procedures because Cornerstone Regional Hospital is next door to the orthopedic facility.
I've had orthoscopic surgery on both knees and been told that it needs to be total knee replacement. So I come to Dr. Marquez, and this was in November 2010. So we did it the 3rd of January 2011, the right one, and it went wonderful. And then we went traveling this summer, and when we came back on the way to Texas, I made an appointment with Dr. Marquez to get the other one done. So within a week after we got located down here again, I was back in surgery, getting the second one done. And it's made such a difference in my life.
The practice here is very unique because Dr. Marquez is a very unique individual. He is a man of innovation and excellence, and he brings those two qualities into the practice and has it influence all aspects of the practice. He is committed to the resources that are necessary to cultivate that kind of innovation, whether it's at the front desk or in surgery. Everyone is trained and expected to reach high and reach for excellent service for our patients.
Orthopedic surgery for total joint replacement has advanced in recent years, and some of the most dramatic improvements are in the area of computer-assisted surgery. Computers in the operating room make it possible for patients to experience less pain, to recover more quickly from surgery, and much improved outcomes. Dr. Marquez is at the forefront of this technology.
Well, the Orthopilot is a